viewers. Welcome to our program on TSTV, Clear on Health, on African Health Television. Thank you for joining us this evening. My name is Dr. Elusoji Fumilayo. With me in the studio is Dr. Olusegun Ajuwon. Thank you so much, sir, for joining us.
Thank you.
So this week we've been talking about diseases in general. We went down to talk about non-communicable diseases, and we said non-communicable diseases are diseases that cannot be spread from one person to the next. And then we also talked about them as chronic diseases. There are 4 major groups of non-communicable diseases. We have the cardiovascular diseases, we have the chronic respiratory diseases, cancers, and diabetes mellitus. Now, this week we choose to focus on one of the cardiovascular diseases, which is hypertension. Hypertension is a global illness. Everybody is affected by it. Every part of the world is affected by hypertension. Now, hypertension is very serious. It can cause, brain disease. It can cause a disease in the kidney. It can cause disease in the heart. It's something that everybody needs to be aware of. Yesterday, we had another guest in the studio, Dr. Idris Mohammed Liman, and he talked about, hypertension in pregnant women. Dr. Ajuwon yesterday also talked about, hypertension generally. He explained what hypertension was. He told us about, how we say someone has high BP, what blood pressure it was. He explained what people need to look out for, the risk factors. He explains the signs and symptoms people should be concerned about and the complications. Thank you so much, sir, for joining us. So we're going to do a little recap on what hypertension is today. Sir, what is hypertension?
Okay, thank you very much. I think it is not a bad repetition, because the number of people affected hypertensive in the world is big.
Yes.
I mean, about 1.3 billion people are hypertensive in a population of about 7.8 or 7.9 billion people. So if we are saying a disease that affects such a big population,
yes,
and it's even more in countries like our own, that's developing countries, then the more we drum the awareness, the better for everybody. More so, since we said like yesterday that we may not even know, there may be no sign at all that somebody is is having high blood pressure. And yesterday we also said high blood pressure, raised blood pressure is the same thing as hypertension. That's just so. So hypertension is when the blood pressure that we measure is persistently above the normal value. And yesterday we tried to put some figure to it. Normal blood pressure in adults, you will say, is 120/80. We also explained yesterday that when we are measuring blood pressure, we quote 2 figures. There is a bigger figure on top, and then we say another figure. He said the one on top, which I said 120, is called systolic blood pressure. Then the one below is called diastolic blood pressure. This one has some meaning, but I will save the viewers such details. Just to know that when we measure blood pressure, we usually will record it something over something.
Yes.
So we say the normal blood pressure is 120/80 for an adult. But and at any time, any person that when we measure the blood pressure, the systolic is up to 140 or higher, and the diastolic is up to 90 or higher, that person is hypertensive.
Yes, sir.
So we are definite about the diagnosis. Whether it is due to age, whether it is due to drug, whatever the reason, once the blood pressure is equal to or higher than 140/90, that's hypertension. And yesterday too, we said this pressure is generated by the heart, because each time the heart pumps the blood into blood vessels, especially the arteries. So anytime the heart contracts to push blood so that the blood can keep flowing, it causes a pressure in the blood that is flowing on the wall of the blood vessel, of the arteries. That is what we measure. And so hypertension is when blood pressure is higher than that figure.
Yes.
And we also said that blood pressure varies, even in an individual. Or you should not persistently stay at that level. We also said first reading, unless it is so high, we should repeat it before we now say somebody is hypertensive. At least it should be repeated 3 times, maybe on 3 different occasions. And once that figure is higher than what I quoted, then you are hypertensive. So that is what hypertension is.
Thank you so much, sir.
Right.
Yesterday we promised viewers that we'll show them what the BP monitor looks like. For us to say someone is hypertensive, you have to have taken the BP monitor before it, and then you write those values.
Okay.
Sir, we'll just do that right now.
All right. Yes. As we said, it has to be measured, because it is not, there is no change in color or change in size or anything that you can see on the face. So until you measure it, there may be no symptoms. And like we said, if there are symptoms, most likely that blood pressure is in very, very high, it's very severe. So the standard machine, which is called sphygmomanometer, is the mercury type. This is the standard. It has what we call a cuff, which has some rubber inside and a long end, so that we tie it around the arm of an individual, and we raise the pressure. There is something like a pump here that we raise the pressure inside, and we now listen. So this one goes with the use of a stethoscope. Goes with it because you will listen over an artery. You put the stethoscope over an artery, while you put it in whoever is measuring it, we put the stethoscope there, put it over an artery. Now, once we raise the pressure on of the curve that occludes the artery, we raise it to a higher level, so that blood cannot flow out in the. So which means when we put the stethoscope at that, we can't hear anything. We will now start reducing the pressure gradually. We release the pressure gradually, and it will be coming down. So when we reach a stage, the a sound will be heard. You will hear a sound, and the first sound is the one we call systolic blood pressure. When you keep going, it will keep going down. You will keep hearing the sound. It is at a point it will also stop. You stop hearing the sound. At the point it stops is the second reading. So the first time you hear it is the systolic. That's the one we write on top. Then when it stops, when you stop hearing that sound, it's also called, that's what is called diastolic. So that is one. That's the standard. Mercury type is the standard. But there are also automated. The one that is automated, that is to say, it uses battery, and some of them do not need. You don't need the stethoscope. So again, but the principles is the same. You wear the cuff.
Yes.
Is also tied round the arm, one of the arms, and any of the arms can be used, either left or right. So you tie it round, and automatically, once you put it on, the machine will the pressure will also be going, raising, occluding the artery in my arm. So it will, when it gets to a place that it has passed the stage of my systolic blood pressure, it will stop and start to automatically also come down gradually.
Yes, sir.
And the machine will automatically record when the first sound is heard and when the last one.
Yes.
Now, what my own pressure has shown now is 132/94. Which is, whereas if I ask doctor to check with the mercury, it is much lower. My blood pressure is much lower than that. But because I was talking while the machine was moving, that is why the pressure, my pressure seems higher than normal. So the disadvantage of this automated or electronic blood pressure machine is that it is very sensitive. So while it is reading, one should keep silent. You should also be free from all activities while it is reading. Because anything you do, just like we said yesterday, that blood pressure varies. So when you are talking, it goes up a little. When you stop talking, it comes down. If you make movements, it goes up. If you are exercising, it goes up. So this is a normal thing. But issue, and that's why we define hypertension as being persistent. So even when you are at rest, your blood pressure is still this high, then we say you are hypertensive. So the disadvantage of the electronic one is that it is too sensitive, that you will have to repeat the monitoring at least 3 times every time you are using it. Not just once. Repeat it 3 times and take the average. And make sure that while the machine is doing his own that's pumping the arm and releasing, you do not make movements. You can, most of the machine, you will hear it that is pumping. At that time, even if somebody knocks on your door, don't turn to look at it. If somebody asks you a question, don't answer until the machine has finished its reading. And it doesn't take more than a minute. So at that time, you have to be certain that you are not making any movement or no activity. Now, another thing is we want to make sure that the blood pressure machine, that is, the BP machine, is at about the same level of the heart. Our heart is on the left side, about around under the left breast. So we want to make sure that the blood pressure machine is kept on maybe a table or a pillow, so that the level is about the same level with the heart. The same thing with even the mercury. You want to make sure that where the machine is about the same level with the heart. So that's one disadvantage of this. Another, so you have to take it many times. And apart from this, now we have some that they tie it around their thumb and they can get their blood pressure. Some are available, all these electronic ones are available as a wristband. And even some of the smart wrist watches, they also can monitor blood pressure. But the standard monitor that we can trust is the mercury type. So that's why, whereas the advantage of the electronic type is that you can own it. You can do it yourself. You don't need a stethoscope. So you can do it yourself, or somebody can do it for you. But once in a while, we advise that one should still go to a health center where they will use the mercury type to make sure that your machine is, to standardize it, to make sure that your machine is still reading well. Because it uses battery. If the battery is low, it may give wrong reading. That's another disadvantage. But the advantage is you can travel with it and you can check your own blood pressure by yourself, which is advisable, that we should do regular check. To know whether you are hypertensive in the first place, and if you are, once they start you on treatment, it is also advisable that you should be monitored. So you can do it yourself at home, but at a fairly regular interval, see your caregiver just to cross-check that the pressure is okay. There are other specialized monitors that have been used to measure blood pressure too by heart specialists. But basically, these are the 2 main types of sphygmomanometer or blood pressure machines. The mercury type, which is the standard or the gold standard, and then the electronic type, which is mobile. You can take it anywhere and you can do it yourself. So those are the types of machines that we use measure blood pressure.
Thank you so much for that explanation. So I hope we were able to see what the BP monitor looks like, so that when we get to a health facility or we see people using it, we are aware that this is what it's used for. And then you also heard that you can own one. It doesn't have to be always in the hospital that you get to check your blood pressure. You can own one. But if you are a patient that is having hypertension and you're currently being managed by your doctor, it's good for you to go from time to time to a health facility and have them measure it in the facility, so that they can know how well you're doing on the drugs you're taking, or how not well you're doing on that drug. That's very important. Thank you so much, sir, for doing that. Thank you so much, sir, for that explanation. It's very important that we know that. So briefly, I'm going to talk about the burden of hypertension currently in Nigeria. Yes, we're going to talk about the burden of hypertension currently in Nigeria. But before then, I want you to call in. We are available to take your calls to answer your questions. Our number is 09071115342. So in the world at large, about 46% of adults with hypertension are unaware that they have the condition. An estimated 1.28 billion adults aged 39 to 70 years worldwide have hypertension, and about 2/3 of those adults are living in low and medium income countries. Now, the total world population is 7.9 billion. So that means we have about 16% of the world's population being hypertensive. Hypertension is a major cause of premature death worldwide. Now, one of the global targets of non-communicable diseases is to reduce the prevalence of hypertension by 33% between 2010 and 2030. Now, in Nigeria, high blood pressure puts 1 in 3 Nigerians at risk. Now, this figure has grown by 540% since 1995. What that means is that in 2020, about 28 million cases were recorded, but in 1995, it was 4 million cases. Now, a recent study conducted in Nigeria showed that among people with high blood pressure, only about 29% were aware, and only 12% took medications. This is it's really burdensome to know that currently in Nigeria, that's what we are facing. We have a lot of people not being aware, and even those that are aware don't want to take medication. Now, about 13.5% of the total population in Nigeria is affected by hypertension. So it is worrisome to me, because I can imagine what 5 years from now will look like. How many percent of our population will be hypertensive? And we know that there are some driving force towards these things. We have more people compared to 1995. You have more population. You have a lot of urbanization. People are pushing towards eating the way the Western world eats. We have change in diet, change in lifestyle. A lot of people, instead of the days of activity where you play sports or you do something active, people are mostly on their phones in front of their TV. So we have a lot of things that are causing this to happen right now. So please, we want to hear from you. We want to hear what your views are. Our number is 09071115342. So, Dr. Juwon, I just talked about a little statistics about what is really going on in Nigeria right now. If you say 1 in 3 Nigerians are at risk for high blood pressure, where are we going to, sir?
Well, that is the fact. And the fact, which you also just stressed now, is about 1 in 3 also people that have high blood pressure are not aware.
Yes.
Some don't even want to be aware. Some will say, leave me alone. And maybe we'll come to it, but the morbidity, that's the disease or the complications that come from undetected and therefore uncontrolled blood pressure. There are many.
Yes.
And they are more, they demand more. They put a lot of pressure on the health facilities that is weak to start with. One, the population is increasing. The number of carers is not growing in proportion to the growth of the population.
Yes.
And many of these caregivers are also leaving the country for one reason or another, mainly for economic reasons. So if we are saying the number of patients that are affected is increasing, the number of people that can look after them is decreasing, and the disease is not aware, it's not giving us that don't worry, that the complication is the same as it is here in Nigeria, in Africa, just like it is in Europe or in America. So we have to, if we must save ourselves, because a healthy society is one that can develop well. If we have to keep ourselves healthy and prevent the complications, something has to be done. And one of the few things that can be done is what we are trying to stress, that try and know what your blood pressure is by checking. Try and follow what the advice, the health advice that is being given by health caregivers, especially about lifestyle, what we should do, what we should stop doing. I mean, there are modifiable factors, risk factors. There are those that are not modifiable. The ones that are not modifiable, you do your best. Yes. But there are many that you can do something about, especially lifestyle, which is what goes into your mouth, whether it is in form of cigarette, whether it is in excessive use of alcohol, whether it is food that is too heavy, eating them at, too large and not correct, plenty of sugars, plenty of salt. Those are things that we can do something about. If we say men are more commonly affected by hypertension, there's nothing any man can do about that. Your gender is your gender. But we know that whether you are a man, whether you are a woman, if you exercise, if you avoid excessive weight gain, if you watch what you eat, especially how much salt, how much sugar you eat, and you exercise, you will be able to delay the onset or prevent it. And so this is, this is why we are stressing this, that no, because the reality is it is going to continue, the number is going to continue to grow. Unfortunately also, for a few, maybe mainly socioeconomic reasons, many of us are living in denial. That no, it's not my portion. Even families that have people with hypertension, and we are established that hypertension runs in the family. Yes. So if you have a member of your family who is hypertensive, from whatever cause, where it may just be telling you that you also have the tendency to become hypertensive. So it is good to know that you have. And if you now know you have, of course, it is not a death sentence if you do something about it. It is when you don't do something about it that we are inviting the complications, which we'll probably mention today. And those complications will further put burdens on the family. Yes. Because when the complications arise, then the whole family will now be affected. You are saying maybe you are keeping it to yourself before. Now you have a stroke because of an undetected and untreated high blood pressure. Then you have a stroke. Somebody must look after you. If the stroke is the type that you don't die immediately. Imagine it's the type that kills immediately. Then if you are the breadwinner, then we are saying that members of the family will have no breadwinner again, and they will suffer. They are the risk of, they are now vulnerable. Because who is going to look after them? Everyone has his own problem. We have not reached where we ought to reach, where you have social network for people that are vulnerable. Everybody is still caring for you. It is everybody for himself, God for us all. So it is to prevent such problems that we are saying it is safe, it is advisable, it is also cheaper to know whether you have high blood pressure or you don't have. If you don't have, to prevent yourself from having. If you have, go for treatment. So that's, I mean, the burden is not likely to get lighter. Yes. It is going to increase if that's why we are saying whatever we have to do, whichever way we have to say it, to make people more aware and ready to do something.
Yes.
So let's stop denying that, oh, it's not my portion. Unless you check. And, oh, yes, my, people of faith will say, no, my faith can. Yes, we know faith has its own role. Then stress is also something that you can't run away from. But we must be able to accept that this is a source of stress and do something about it. Because these are things that are predisposing factors or risk factors to developing hypertension. Or even when you have developed hypertension, managing it will also become very difficult unless you take care of stress and also modify this lifestyle that are harmful to a more safe lifestyle or healthy lifestyle.
Yes, sir.
Right.
Thank you so much, sir, for that explanation. So it goes to show that we need to take our time to make sure that we listen carefully to all that we are saying. This is an information that is very important to us. Awareness is key to prevent, the complications of hypertension. Please, we'll be going on a break shortly. Please do join us when we come back. Thank you.
Check out healthy recipes of food for thought, showing next on AHTV.
First up, and you cook it just a little bit longer so that the milk solids in it get nice and toasted, and it brings this really lovely nutty flavor to everything. I love this stuff, and it is wonderful on popcorn.
Welcome back to our program Clear on Health on African Health Television on TSTV. Thank you so much for joining us. Before we went on the break, we talked about hypertension. We introduced what it was about. We also showed, the BP monitor, blood pressure monitor, what it looks like, how it takes the blood pressure reading. Then we also went down to talk about the burden of hypertension in the world at large and also in Nigeria currently. And we said about 13.5% of adults in Nigeria currently have hypertension. That's a very large number to compete with. We also went down to talk about, Dr. Ajuwon talked about, what certain things that we can do to actually prevent hypertension. He mentioned, avoiding stress. He mentioned that awareness is key to knowing that you have hypertension and also doing something about it. Because in Nigeria, it's like a lot of people are aware that they have high blood pressure but are not willing to do something about it. So I'm going to talk about some of the risk factors of hypertension. Now, one of the risk factors of hypertension is a family history of the problem. If someone in the family has hypertension, if father, mother, auntie, uncle has hypertension, it's very likely that it runs in the genes in the family and you are likely to develop hypertension. So that awareness or that information should make you want to do certain things to prevent hypertension. Also, obesity can cause hypertension. Obesity can push you to having hypertension. These are some of the things that can cause hypertension. Also, sedentary lifestyle, not doing a lot of activity. The heart needs you to move. The heart needs you to, take movements and, do activities. If you're not doing a lot of activity, you are, predisposing yourself to hypertension. Drinking alcohol can push someone to having hypertension. Smoking causes narrowing of the vessels. All these are some of the factors that can, make someone hypertensive. Sir, are there other factors that can, cause, be a risk factor for developing hypertension?
Yeah, I mean, it is related to lifestyle, like what we do.
Yes.
Like, you mentioned smoking. If you like too much salt, it is also a risk factor.
Yes.
If you eat too much fat and too much sugar, it is also a risk factor.
Yes.
And some people, they say they have sweet tooth. So be careful, especially if there is a family history
of hypertension.
Right.
So we see that we need to find a balance in what we eat, what we take in, set in our behavioral patterns. You are alive for a reason, and then you need to make sure that that life counts, and you need to take care of your health. This body is a vessel that everybody has, and we don't have duplicate vessels or duplicate parts waiting for us to use. So we need to make sure we take good care of our bodies. So, sir, what are the signs and symptoms? I know we mentioned some yesterday, but we need to know, because we know that hypertension is described as a silent killer. It doesn't really give a warning, but there are certain signs that people should look out for.
I mean, that's the reason why it is in that class of silent killer is many, in fact, as like maybe 1 in 3 will have high blood pressure and there will be no symptoms at all. That's why it is called is a silent killer. That's no. But when the level of blood pressure is high, there are some signs that can show. Severe headache may be a sign of severe abnormally high blood pressure. Visual disturbance may also be a sign. If you have chest pain, it may be a sign that maybe your blood pressure is high. If maybe you feel that your heartbeat is irregular, or you feel that your heart is beating, this may also be a sign. If you see blood in your urine, it may be a sign that you have high blood pressure, or you are not doing anything, or maybe you just sneezed or you touch your nose and there's bleeding, nose bleeding. This may also be a sign. Feeling confused may be a sign. So that's why, I mean, but we started by saying many people may have no sign, especially until the blood pressure is severely elevated. There may be no sign. I remember we went for a health outreach in a village, and one of the few things we do at health outreach is to check blood pressure, check sugar. I checked this grandmother's blood pressure, and it was so high that I said she has to be on admission that day. But she actually came, she was backing one of her grandchildren. No complaints at all. We had to take her, arrange for her to get to the nearest hospital so that she can be admitted. Because we need to bring the blood, because it was so high. And I checked it 3 times, it was still that so high. Whereas no dizziness, no headache, nothing. She came. So I think that it is important to know that the fact that there is no sign does not mean, or symptom does not mean you don't have hypertension.
Yes, sir.
And when you do have symptoms, it may mean that the level is dangerously high. And we mentioned that there is a stage that we can say is normal blood pressure. There is a pre-hypertension before the systolic gets to 140. If you check it and it's 130 something, you check it again, it's still 130 something persistently. We are just saying, well, let's watch it. What are you doing wrongly? what you start to do rightly. And then but once it is 140 and above, we say you are hypertensive. So it is important to say that there may be no symptoms. But if for whatever reason you just find that maybe some flashlight, some flashing in your eyes, or you have this severe headache, or maybe you find you went to wee and you see blood there, then it is, even if there is no other sign, it is time to check to see whether you have high blood pressure. So these are some of the signs, and these are some of the symptoms.
Yes,
sometimes, unfortunately, it is the complication that bring people, you then discover that they have high blood pressure. It is when the complication has, like, if the blood vessel to the brain suddenly bursts, or is occluded, or there is some heart issues, you now check and you say, the blood pressure is very high. And that may be the first time people are knowing. That's why we are saying, in order to take ourselves out of these bad statistics, 1/3, 1/5, 20%, to take ourselves out of it, just check. And it doesn't take time. To check blood pressure does not take time.
Yes, it doesn't.
So that is the essence of knowing that what are the signs, what are the symptoms. Then maybe, as I said, maybe we'll mention complications.
Yes, we would.
The complications will be, if you look at the brain, it may, there may be stroke. Commonest complication of the, of hypertension is in the brain is stroke. And there are two major types of strokes. There is one that the vessel will burst. That one is more severe. In fact, the mortality or the death rate in that type of stroke is higher. They may not be able to, they just die. And then there are the one that it is a slow pathology or problem with the blood vessels, and then it is blocked. That's the one we call ischemic stroke.
Yes.
That one does not lead to immediate or a sudden death, but in either of the two types, there is paralysis of one side of the body. So if it affects my left side of the brain, it is my right arm and the right leg that will be paralyzed. If the burst pipe or the blockage of the blood vessel is to my right hemisphere, right half of the brain, it is the left side, both the upper and the lower limb. And it may also affect the face. So these are the complications. Another complication is in the eye, because high blood pressure that is not looked after properly can cause some bleeding in the blood vessels inside the eye. This will affect vision and may even lead on to blindness. Glaucoma is also tends to be commoner. So which is blood pressure in the eyeball is also higher than normal. So these are some of the complications in the eye. It can also affect the heart, because the heart itself, even though is the one that is pumping blood, is a living thing. So it requires blood supply. The blood vessels that supplies the heart muscle itself can also get problems, can get either blocked, and a part of the heart will not have blood supply. So you have chest pain, which we call angina, and there may be a sudden death of a part of the heart muscles, which is called a heart attack. And because the blood pressure means the heart will now have to pump against higher pressure to push the blood around the body, the size of the heart also tends to increase. And if the size increases, it may come to a stage that even if the blood vessels are not thinned, they are stretched. So blood supply is also affected. So the size of it affects the size of the heart, and the heart may fail if the pressure is not reduced by treatment, and the heart keeps trying to overcome the pressure, and it keeps on making effort and beating faster and beating stronger. At a point we get to a point where it will no longer be able to satisfy every part of the body. That's what we refer to as heart failure. So heart failure is also a complication that may come from hypertension that is not properly treated. And the kidneys.
Yes.
The kidney, there are a pair, everybody has a pair, left and right kidneys. They are involved in regulating the total amount of fluid in the body, both the water and blood, and they regulate it. If we drink too much water or too much fluid, you will find that you pass plenty of urine because the kidney is called to action to take care of it, so as to reduce or to control the amount of blood that the heart will have to pump. If the blood pressure is very high, blood vessels that supply the kidney themselves can also now be a problem, so that the kidney is not able to function normally. And since the normal function of the kidney is to regulate body fluids, if the kidney is not functioning well, so it retains water, and it will show as leg swelling, which is worse when a patient wakes up in the morning, the face is also swollen, which suggests that the kidney is now affected because the blood pressure is not being properly looked after. And there is a relationship between high blood pressure and kidney failure. In fact, many times we say which one comes first. If you have high blood pressure, you can have kidney failure. If you have kidney failure, it can also result in hypertension or worsen the hypertension. So which one comes first? It is like, which one comes, is it the egg or the chicken? So that's one of the complications that can also arise from hypertension that is not properly treated. The kidney can fail.
Yes.
So I said the heart can fail, the kidney can fail, the brain, the eye, and so these are some of the complications that.
So what that means is that hypertension is a multi-systemic disease. Like it can affect any and every organ.
The reason is that we are saying it is a problem between the heart and the blood vessels. Every part of the body is supplied with blood vessels. It's just that some organs are more prone. That's why. Otherwise, any part of the body. In fact, if the situation is so high, some blood can even come out from sweat in very intense situations.
Wow.
So every part of the body is supplied with blood, and which means blood vessels go there. That's the meaning of supply.
Yes.
This is a disease that affects blood vessels. So every part of the body can be affected.
Yes.
It's just that some are more common. Blood vessels that supplies the brain, blood vessels that supply the eye, blood vessels that supplies the heart, and blood vessels that supplies the kidneys. They are more prone to this complication.
Yes.
So that's why, and if you have a kidney failure due to hypertension, because it is also possible to have kidney failure from some other reasons.
Yes.
If it is due to hypertension, it's a chronic that has been going on for a long time. Unfortunately, it is both kidneys that are usually affected. God gave us two. 1/4 of one is enough for normal life. So if maybe an accident or anything happens and you lose one kidney or you donate it to somebody else, you can still live a normal life. Unfortunately, hypertension is from the blood vessels. So the two are being affected at the same time. If you now get to a stage and say, look, things that the kidney should filter, because apart from regulating blood, the volume of fluid, it also is involved in the production of blood cells from the bone marrow. There is something that the kidney produces, a hormone that it produces, which works on the bone marrow to produce red blood cells.
Yes.
So if kidney is affected, like if you have a chronic kidney failure, you find that the level of blood drops, so there is anemia. Anemia that you don't look after can also lead to anemic heart failure. Then when we eat food, protein, carbohydrate, proteins are broken down to amino acids, and amino acids, when they are also being broken down, so that that's to make some waste results, some nitrogenous waste. Urea is one of them, We measure this by measuring the blood creatinine and the urea. So the level will increase because the kidney that should filter them and pass it, mix it with water to pass out as urine is no longer functioning well. That means the body is retaining waste product that is injurious to the cells. Ordinarily, we pass it out in the urine, but if that is when the kidney is functioning well. If the kidney is no longer functioning well, we are retaining these injurious wastes. And some cells, like especially the cells of the brain, they are also prone to being damaged by high levels of these metabolites or breakdown products that should ordinarily be passed out in the urine. So we now have a case where you say the urea is so high or the person is uremic. If you do not do something about it, the brain will start to complain, convulsion, confusion, loss of consciousness can occur. So they will have to be going for dialysis. And if you get to that stage, the minimum times of dialysis in a week will be twice. So this, and it is not cheap. Dialysis machine is also a specialized machine. It uses different types of water, different types of fluid. So it is a costly thing. But it is possible to prevent it. And that's why we are saying it is better to prevent, do something about it. Once you know, get your doctor to prescribe whatever appropriate treatment and stick to the treatment. I mean, maybe we'll talk about how effective are some of our alternative treatments. What we know is what we know.
Yes.
Most of the alternative treatment that is being touted, they even cause more damage than good. So what we know is what we know. So it is one thing to know. It is another thing to be given a prescription or a form of treatment. It is the important thing for you to stick to it.
Yes.
And then avoid things that started the problem. Okay. So exercise is key.
Thank you so much, sir. Like this explanation you've given is very important and very scary, at the same time very scary, because what we are saying is it just started from as little as know your blood pressure, know if it is high or low, and then it's going to, okay, you now become hypertensive, and then see the complications in the brain, in the heart, in the kidneys, and then, you know, the vessels. It's a very scary thing. And then we're seeing how very related kidney failure is to hypertension. And we're saying even when the patient has hypertension and they are having kidney failure or chronic renal failure from the hypertension, it affects the both kidney, not one of the kidneys. That's a very costly mistake, because if we're saying you don't want to know about your blood pressure, you don't want to know about prevention, well, it's almost like you're saying penny wise, pound foolish, because you're going to end up spending so much more on healthcare than if you just took prevention seriously. So awareness is key. That's what we're really trying to do. We're trying to show you the machines. We're trying to, you know, show you this information is very important, because if we are having about 13.5% of our entire population cases of hypertension, that is something that we should all be scared about, because we are concerned about our children, we're concerned about our grandchildren. What is the picture of hypertension going to look like at that time?
Okay. Yeah, another thing, maybe since you say scary, to end to add to it, anyone that we say has kidney failure, either, you know, mostly because of high blood pressure, we are just giving dialysis, that's hemodialysis, as a stopgap. It's like an artificial kidney.
Yes.
As a stopgap to having kidney transplant.
So we are waiting for transplant.
So if we say we are waiting for transplant, we are saying we want to get somebody that his kidney is normal to donate one. And then we give. There is also always the possibility, because you are a complete person, an individual, a specialty of God, that anything that does not belong to you, your system recognizes and it fights it. Even when somebody has donated a kidney to you, to save the one you have lost, your system is still, your immune system is still fighting that one, fighting the one that this is not my own. So such an individual will also be on drugs to reduce your immunity from
Yes.
from recognizing that kidney is
foreign
not your
kidney.
own. So either way, it's a loss.
Yes.
So it is better, it is cheaper to prevent.
Right.
from
Because if
getting
you are
it.
even afraid of, because I think one of the problems we have in Nigeria is people don't want to be aware so that they don't take drugs. People don't want to be aware so that they don't take drugs. Please, we'll be coming back from a short break. We'll go on a break now. Thank you so much for joining us. You can join us back when we come back. Thank you.
And welcome to Clear on Health.
TSTV, connecting your world.
And welcome to Clear on Health.
Good evening, viewers. Welcome back to our program. Before we went on the break, we were talking about hypertension. We went on to talk about, how BP is being monitored. We showed you what the BP machine looks like. And then we also mentioned that some of the risk factors for having hypertension. We talked about a bit about the complication. We were talking about the complication before we went on the last break. So now we see that if you don't prevent high blood pressure, or you don't treat it when you are aware that you have high blood pressure, you are putting yourself at a risk for a lot of other diseases, the brain, the kidney, the heart. All these are organs that can be affected. And what that means is that if you're avoiding taking the few drugs that you need to take for hypertension, you will end up taking more drugs for other things, or even become a liability in the case of stroke to your family members. So these are very costly consequences of having high blood pressure that you don't manage, or you don't treat, or you pretend not to know that you have. So, Dr. Juwon, before we went on the break, we talked about all these things. So, assuming somebody is aware that they have high blood pressure and they want to treat it, what would be your advice, sir?
Okay. As we said, there are stages.
Yes, sir.
So if it is still pre-hypertension, that is to say, we will stress lifestyle modification. We will also stress that, look, mind your diet. But now this is hypertension, diagnosed, and you have been told and you have accepted now you have high blood pressure. We say there is no cure yet. We are still searching, because majority, we don't really know why it all started. So you need treatment. So if we try non-drug treatment, that is to say, we're not prescribing any drug. We're just saying, please reduce your stress, please sleep more, make sure you exercise at least 3 times in a week, mind how much salt, please reduce the sugar amount of sugar you are taking, and we see again, maybe we give 4 weeks, we see again. If the level is still not lower than 140/90, then we have to introduce drugs. And since we have said that hypertension is a function of the heart itself, the muscle that pumps the blood vessels, especially the arteries that receives the blood and bring it back to the heart, then the mode of treatment and the amount of blood that is involved, because every depending on your size or your age, also that's what determines the volume of blood you have. So these are the factors that are involved in the pressure. If maybe 10 units of blood is available for the heart to pump, it has to generate enough pressure to pump the 10 units round whichever position you are taking around the body. So the more the volume, the more the pressure that is required. So there are some drugs that is to reduce the total blood volume. So that is a class.
Yes.
A few people will be started on that class to see plus lifestyle modification. Then there are other classes that we work on the heart muscles itself, either to reduce the rate at which they are beating or the force with which they are beating, because this is what determines the pressure. Then there are drugs that work to relax the blood vessels that is taking the blood around from the heart to the part of the body. So these are the classes. And there are some that are acting on the brain, because like we said, stress is a factor that is maintaining high blood pressure. So there are classes of these antihypertensive drugs.
Yes.
So your doctor will determine where to start from. If one level is not doing enough, they add more.
Yes.
They add more. And there are many drugs now, many drugs in these classes that I've mentioned. Newer drugs are also newer classes are coming out, but we leave that to your doctor. Now, one thing I think I should warn here is, yes, my husband is hypertensive, or my daddy is hypertensive, or mom is hypertensive. This is the drug I see her taking. And then, since they say I have, you just start taking it yourself. It is dangerous. It is good for you to go, get assessed, and let your own regimen be given. What is working for your father or your wife or your mother may not work well for you. And there are side effects to drugs.
Yes.
If a side effect is occurring in one, we change to another one.
Yes.
There are certain class, for example, that they will do the work we want them to do. They will reduce the blood pressure, but they leave the patient with cough, troublesome cough, which may disturb their sleep. So you go and report, and tell your doctor that one, and then the doctor will now find an alternative that does not give that. In men, some of these antihypertensives, they drop the blood pressure all right, but they also drop what we do not want them to drop. They cause maybe erectile dysfunction. So it is good. That's why we are saying, once you are diagnosed and you agree to take treatment, don't leave your doctor. Once in a while, just on a regular, as the doctor says, come back, go back to him. And every time you go back, it's just he or she will measure your blood pressure. Is it okay? Oh, it's good now. If it is good, it does not mean stop the medication, because many doctors too, some young doctors do that. Your blood pressure is normal now, you don't have to take the drug again. The blood pressure will climb back slowly. If the blood pressure is good, the level is, you are satisfied with the level, the patient maintains it. But if the blood pressure is now causing, is getting too low, that you're now having hypotension, then the doctor may have to reduce the dose, or reduce the frequency, or reduce the number.
Okay.
So these are, I won't mention the names of the drugs, just a class. There are several classes.
Thank you so much, sir, for giving us that explanation. So please go to your healthcare professional or your doctor, meet them and let them prescribe the adequate drug that you will need. Today we've talked about hypertension, we talked about the signs and symptoms, we talked about the risk factors. We also talked about the burden of hypertension currently in Nigeria. One of the keys to the treatment or prevention of hypertension is awareness, and that's what we're trying to do on our program Clear on Health. Thank you so much for joining us today. My name is Dr. Fumilayo Elusoji. With me was Dr. Ajuwon. Thank you so much, sir, for joining us. Till we'll see you next week, where we'll talk about other health issues. Thank you.
Welcome to Clear on Health.